The pandemic now, half of the U.S. population is now fully vaccinated, but doctors say it's still not enough. Florida is leading the country in hospitalizations right now as hospitals in Texas face staffing shortages due to burnout. Our Marcus Moore is in Dallas at Parkland Hospital with more. Marcus, you have been hopscotching all throughout the country. So let's just start off by talking about these staffing shortages at hospitals there. What are you hearing from people that you've spoken to so far? And I know that you've just gotten into the area, so it's a working story.
Yeah, absolutely, Kira. But it's a story that certainly is affecting hospitals not only here in Texas but in Louisiana and across the country. In particular the South, where in a number of states the vaccination rates have been far lower than what we've seen in other states in other regions. So that is the atmosphere or the theater where all of this is happening, and in the midst of it, there is a nursing shortage, not only here at the hospitals in Texas, but also in Louisiana. And that's something that's been occurring for quite some time, and you already mentioned it. A part of that shortage is due to the nurses being overworked in a sense, and exhausted and tired, and they simply can't keep going. And then you also have situations where the medical staff have fallen ill themselves with COVID or other illnesses. So it's created this perfect storm. You have cases on the rise, you have this pandemic in yet another wave, and not enough people to meet the challenge. And what that has created is a situation where a number of nurses are working overtime, Kira. And that's one of the things that we have heard from the nurses and doctors here, that for the past year and a half, it has been all hands on deck, and they have been meeting that challenge. But here they are once again faced with this pandemic that, again, at this point, in many parts of the country, are showing no signs of slowing.
So, Marcus, what do healthcare workers say that they need? You know, in some states, they're saying they'll give bonus checks to more nurses if they come and work at the hospital. What are you seeing as efforts to just combat the exhaustion and also the stress and the anxiety?
Well, it's interesting you bring up the compensation, because as it stands right now in terms of the nursing market, a lot of the hospitals are having trouble keeping nurses because there's the traveling nurse option, which is incredibly lucrative right now. Nurses who are paid to go to hospitals that are understaffed to help meet the needs there, and it has left hospitals in a number of cities left short-staffed. Without people to be there full time. So, but even with the potential for a big payout, if you will, there are nurses who are saying no amount of money would keep them at the bedside, just because of how stressful this has been. So when you get to that point where no amount of money could get them to stay, what we have heard from nurses that I've met, nurses and doctors, all of them in these past couple of weeks have said what they need people to do is to get vaccinated, and if you're not going to get vaccinated for whatever reason, to make sure you wear a mask, because they have patient after patient coming into these hospitals suffering from COVID that they have to try to treat. And Kira, that's in addition to all the other patients who come in with various medical issues or trauma from car accidents, you name it. Those things are still happening.
So when you look at the cases of COVID and the impact of the Delta variant, and then, as you mentioned, there's all the other issues of patients coming into the ER, like with car accidents and other problems, how is this impacting the doctor's ability to treat patients, all patients?
Well, what it has come down to, Kira, in a number of situations is some people, as one doctor in Houston said, unless you are at death's door, you are likely going to have to wait to get treatment. And that is not the situation or the scenario that any medical provider wants to be in, nor do they want to put somebody who needs help in that situation either. But that's the reality from what we are hearing from doctors here in Texas, and in particular in Houston. And Kira, there was a situation, we've been talking about how kids have become ill.
Right.
We understand that an 11-year-old child had to be airlifted, taken by helicopter to a hospital 150 miles away from Houston. They went to Temple because the child was so critically ill and there was no available bed space. So that is the impact that it's having, and it's the reason why they are so emphatic and on a certain level desperate to get the message out that people need to either get vaccinated or wear a mask as they endure yet another surge of COVID-19.
And it could be a deadly domino effect. Marcus Moore, I know you're going to have much more for us on World News tonight. Appreciate you, Marcus. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.